Hi, Dr. Kevin Zorn, Founder-Director of BPH Canada, here to talk a little bit about the Foley catheter and some of the complications that I see regularly with patients with chronic indwelling catheters. So part of the enlarged prostate, eventually some men go into the end of the stage disease where they have a blockage, they have a catheter put in the emergency room, they're relieved and they're attempted on medical therapy, or they're put on a surgical wait list and they're waiting several months for surgery. And I've seen some men beyond 12 months. So what are the complications of having a chronic indwelling catheter? Number one, infection. Every day that there's a catheter in place increases the risk of bacteria by 5%. So usually by a month, there's a guarantee that there's bacteria all lining inside the bladder because of this foreign object. So higher risk of infection of the bladder, connected to the testicles. Some people get infections of the testicles, orchitis, epididymitis. So that's part one, infections and growing type of bacteria that's multi-resistant. So that's a big one. Second, risks of bleeding. So certainly patients who move around, who have some kind of tugging, that irritation from the foreign body gets their urethra irritated and they'll have bleeding. Add on to that if someone's on aspirin or blood thinners, that just makes things worse. Other visits to the emergency room. The other one that's also very discomforting, very painful, is some men will get these bladder spasms. They'll have a strong urge to urinate and they'll actually urinate around the catheter. This is especially when changing positions with a catheter in place. And it's related to the balloon at the end of the tip of the catheter, which with a little spike tip that's made of silicone rubs against the bladder, kind of like if I tickle the back of someone's throat, they'll have a gag reflex. That's what's happening. It's a bladder spasm gag reflex, wanting to urinate, and it'll be around the catheter. We give certain medications to try and calm the bladder, but nonetheless, that is a complication of having a chronic indwelling catheter. The fourth one, which I see unfortunately, is trauma. So be it from the insertion of the catheter, sometimes there's a false passage, special catheter tips will have to be used. And the other one is the chronic indwelling catheter with not being well maintained, puts traction. So rather than the catheter coming out of the tip of the penis, some men will have a erosion of the meatus, and the hypospadias is iatrogenic catheter related. So their whole of their penis will come out at the base, different parts of the shaft of the penis, because of mismanagement of the catheter. It's something that's time dependent, and certainly longer catheters, we see more of that. And the other one, again, it's subtle, it's small, but it is irritating to some patients, is they'll have on the inner part of their thigh either a sticker or some kind of tape that they're affixing the catheter. It creates a lot of irritation, glue, and unfortunately, again, coming back to the hygiene and bacteria. So these are all things I see commonly with catheter, chronic indwelling catheters. We try to mitigate that with regular changing of the catheter, irrigation done daily, just kind of like you brush your teeth, you use some Listerine. So the idea, we irrigate the bladder to prevent sediment and stone formation. And finally, the possible use of intermittent catheter. So rather than having a catheter in place all day 24/7, we'll take out the catheter and teach the patient how to insert a small catheter, maybe 5 minutes a day, as a bridge between the initial consultation and their surgery. And that way mitigating a lot of those complications we were just talking about. But nonetheless, this is what I commonly see, and this is the ways that we can look in helping the patients have a better experience, get into surgery faster. So if you or any of your loved ones are dealing with catheter and like more information, please visit us at BPH Canada or give us a call, 514-443-0808 for consultation to see how we can help you and get better treatment faster.